Hello viewers, Namaste. So today I have chosen the subject PCOD or PCOS for my talk. It's a very widely discussed subject these days. It's a condition affecting women. It is a disease condition affecting women, and it has caused a lot of concern and fear among women of today's age because it's very common these days, seen very commonly these days, irrespective of the age group, I would say. Anyone in the fertile age group, like from menarche, that is the onset of menstruation, till menopause, could get affected at any point. So that is the reason for such wide discussion, and I have chosen the same subject again today. So PCOD is the polycystic ovarian disease, and PCOS, when we say, it is a polycystic ovarian syndrome. There is a difference between the two. Now basically, to understand what these cysts are, or when we say polycystic, what are these cysts? Cysts are nothing but bubble-like structures present in the ovary, or which develop in the ovary. They are not present in the ovary as such, but they develop in the ovary. And the cyst could either be single, which is called the solitary cyst, and in which case it is just diagnosed as an ovarian cyst. But when they form a group of these cysts, either in one ovary or both the ovaries, then the condition is called a polycystic ovarian disease. And when these cysts start functioning or behaving like proper structures, like with the release of hormones or bringing about some changes in the body, giving rise to symptom complex, then the condition is called as PCOS or the syndrome. As I mentioned, it affects women of all age group, starting with the onset of menstruation till the menopause, and the predisposing factors or the conditions leading to this PCOD, development of PCOD or PCOS could either be genetic. That is, if women in your family, it could be your mother, it could be your aunts, it could be your sisters, if they have PCOD or this condition, PCOS or the polycysts, then you are at a higher risk of developing this condition. And then next, and the foremost important factor, I would say, whether you have a predisposing factor or otherwise, the predisposing genetic factor or otherwise, would be the lifestyle. So when I speak about lifestyle, it is the obesity that we need to try and avoid or prevent, because obesity can lead to PCOS or PCOD. Now, the factors leading to obesity, like high blood sugar, inactivity, high stress levels, high intake of saturated fat and trans fatty acids, can all lead to obesity and thereby to PCOD. So these are the factors in general that you need to try and avoid when you make a change in your lifestyle, because it is a preventable condition. PCOD is a preventable condition. So our main aim should be to prevent the occurrence of this condition. Now, what are the signs or symptoms that you can look for to assess this condition? Of course, the final assessment has to be done by a doctor, but at your level, at your home, what are the things that you can look for yourself or for your children or for the women around you? One is the development of acne on the face. The acne could be sometimes painful and pustular too, and this need not be only on the face. The acne could be sometimes seen on the chest, and sometimes it also occurs in the upper back region. The next symptom or the sign that you could look for could be the growth of coarse hair, bodily hair. Now this could be the mustache, like male pattern. There can be thick growth of mustache, or the hair around the chin. There can be growth of hair around the chin, sometimes around the on the cheeks. You could see it on the cheeks as well. And the growth of hair, this coarse hair growth, could be on the chest. it could be around the nipples or on the abdomen. So when you see this pattern of hair growth, then it could be a pointer towards the PCOD. And the skin by itself could turn very dry and rough skin with pigmentation. So the pigmentation could be anywhere on the face, the forehead, the chin region, and mostly it is seen around the neck. So these are the signs that you could look for when you which are pointers to PCOD or PCOS. Now when you see these, then it's time that you visit a doctor. Now you may not always have menstrual irregularity, so it's not a clear-cut sign. Irregular menstruation may not be seen in most of the cases of PCOD. I would say most of the cases coming to me do not present with this symptom. And likewise, there can be no pain. PCOD is not a painful condition. It does not give you painful menstruation or abdomen pain even any time during the cycle. So, but still, if you notice some irregularity in your periods, it's always better to visit a physician. Now, when you visit a physician, what are the things that they would suggest that, you go in for, or you get the blood tests or the scans done to help them diagnose the condition would be the blood test for high sugar. Because insulin resistance is something which is very commonly seen in this disease condition. So we would look for high blood sugar levels. If at all there is high blood sugar level, then that is indicative for us towards indicative of PCOD. Or the insulin resistance, that is, there can be hyperinsulinemia, there can be higher levels of circulating insulin in the blood, which is also a pointer. The hormones, testosterone, prolactin, estrogen and progesterone can all point towards this. The abnormal levels could point towards this PCOD. So these are the things that we would generally look for, because ovaries by itself, the function of the ovaries is to release ovum and also the secretion of these hormones, but there is a normal level for its secretion. So if you see an abnormal level, it could be these cysts functioning as the hormone glands releasing the hormones, and so it is very essential for us to get this screening done, which would be advised to you anyways by your physician. Now ultrasonography could reveal the presence of cysts in the ovaries, and then that is also a clear-cut indication or a diagnostic tool for this condition. Now, once you have been diagnosed, as I mentioned to you earlier, prevention is always better than cure. So you should try and prevent the occurrence of this disease. But once it is diagnosed, you may be advised to go through some hormonal medications to correct the hormonal levels, or other medications to correct the hormonal levels. But apart from that, I would suggest that you always go through a lifestyle change. You correct your lifestyle. That can bring about a lot of change. It can give you very good results. Now, this lifestyle correction should be through your food habits, correcting your food habits and the exercise pattern. Now, I am not going to tell you about again about what should be done, because these are already discussed in my previous videos. So you can watch the video that I did on weight gain, and that can help you correcting your lifestyle. Now, apart from correcting the lifestyle, a naturopath's role would be to help you correct the hormones, and that is through natural means. We do not give you any internal medications. So, but we can advise you, we can give you suggestions to help correct the hormones and thereby get rid of all the symptoms. And we can also give you acupuncture. Now, why acupuncture? Because acupuncture can definitely help you get rid of this disease condition, PCOD. Now, including fertility and other issues which come as a consequence to this PCOD. Now, I did not mention to you about this, the consequences of PCOD or the fear factor. Why is PCOD such a fear factor? It is because it is one of the main condition or a predisposing factor to infertility. So we see that more and more cases of infertility would present with this PCOD, and that is the reason that they have this issue of infertility. And it can also lead to some conditions like diabetes. Type 2 diabetes is caused because of this PCOD condition. And as I mentioned to you about the high levels of insulin, circulating insulin in the blood, right? So that is because of the insulin resistance, and this insulin resistance can sometimes develop into a syndrome, giving rise to complex disease symptoms or conditions together, like obesity. It can be the diabetes, then there can be dyslipidemia, that is the levels of the cholesterol and the lipids in the blood. Lipids or the fats in the blood can go deranged, so that is what is a condition of dyslipidemia. High blood pressure. So these are all the conditions that can come together and form a syndrome by itself. That is in the later years. It may not be evident as soon as the PCOD is detected, but then in the years to come, if it is left unattended to, if it is not been addressed properly, it could lead to these conditions. So when you come to us, a naturopath, we will be able to help you with these conditions, prevention of these symptoms. And if at all you have already got this, these symptoms, we will be able to help you get rid of these. So acupuncture helps to correct the PCOD, and it will also help to correct the conditions arising out of PCOD, including fertility. And a naturopath can also give you tips on how to improve your the health of the pelvic organs and the ovaries in particular through some doable packs and baths at home, which we can suggest. And so it would be always better if you can visit a naturopath and get these advices and start practicing it. And but to top the list, it is always prevention. So try to correct your lifestyle and prevent the occurrence of PCOD and any disease for that matter. So stay safe, stay healthy. Bye.